I think everybody in the back of their minds has this idea that we are being advocates for the children that we are caring for as well, and for the children in the community of Chicago. And even though we tend to focus a lot on our clinical care and on our scholarly activity, our research activities, the quality improvement efforts and the advocacy efforts and the teaching of our medical students is all, I think, considered to be an equally important part of their education. I'm Bill Muller. I'm the program director for the Pediatric Infectious Diseases Fellowship Program.
I'm Leena Mithal, and I'm the Associate Fellowship Program Director for the Pediatric Infectious Diseases Fellowship Program. We are an urban center, and so we see patients across race and ethnicity, across socioeconomic classes. We see all ages and all disease severities, and so seeing a newborn baby to a 20-year-old that's been living with HIV their whole lives, from a patient that has critically illness, infection that we can see restore them back to their full 100% potential and cure that infection, but also seeing the patients that are fighting for their lives.
We have a lot of overlap in interests among the different faculty members within our division, which is really, I think, a benefit to our fellows because they get to choose projects that sort of sit at the interfaces between individual specific interests. But also there's a lot of collaboration between divisions and between faculty in different divisions. So even though I work with our HIV program, actually my large amount of my clinical activity is with the transplant program, and so I work with our cardiologists, our gastrointestinal specialists who do liver transplants, or renal specialists, in order to provide the expertise in infectious diseases that their immunosuppressed patients need. What distinguishes us, I think, from some of the other centers would be the academic opportunities that people will have at either the medical school campus, which is right next to our hospital, or at the adult hospital, which is right across the street.
If fellows do want to get additional training in scientific research or a public health focus, there's opportunities to help our fellows get additional formal didactic training, including master's programs.
We've really made an effort to try to focus on some of the stronger programs within the hospital and to try to grow our cutting edge medicine within the hospital. And that's not just basic science and translational science, but also bringing the biggest clinical trials to the hospital and making sure our patients have access to the newest medicines, and that we are always very thoughtful in how we take care of our patients. And I think that distinguishes us.
I think the culture here at Lurie Children's is collegial and friendly and progressive-minded, and is a wonderful supportive environment for both trainees and attendings and colleagues.
We have a spectrum of applicants to our program, and some of them will come with a really strong idea about what they want to do, and that makes it our job to match them up with the appropriate mentorship that they can go on to develop their career in that direction. Some of them will come to us with an understanding that they really like the field of infectious diseases but don't necessarily have a specific direction that they want to take their career in. And then it's our job to really help them explore the different areas within the subspecialty and identify what motivates them in a way that will allow them to progress into the career direction that they choose to.
Chicago as a city is clean, affordable, diverse. On top of that, our location is, between Lake Michigan and the Magnificent Mile, between Millennium Park and, Water Tower Place, sort of in the heart of the city.
I'm pretty sure that my wife and I have gone to different restaurants twice a month since we've been here and enjoyed every one of them. And we certainly take advantage of all of the cultural activities and the sports teams and the lake.
Best of luck. Thanks for your interest in our program, and we hope to talk to you soon in the interview process.